Hi, good afternoon, everyone. You're here with Derek Anderson, the Executive Director of Northern Westchester Hospital, and Dr. Marla Koroly from our Chief Medical Officer. Give us just one moment, please, while we connect with our Facebook viewers. So give us just a moment. Hi, good evening. My name is Derek Anderson. I'm the Executive Director of Northern Westchester Hospital here in Mount Kisco. We are joined with Dr. Marla Koroly, the Chief Medical Officer of the hospital. We appreciate everybody joining us this afternoon. We're going to give you a brief update on where we are, everything COVID and the vaccine as of today. As information changes very quickly, we'll try and get that to you as best as we can. First of all, thank you for staying connected. Thank you for reaching out to us and asking questions. Certainly a complex time for all of us to be navigating the changes, and even as recent as today, the announcement from the governor, and we'll get to that in just a moment on eligibility. But first of all, thank you for joining us. We do want to express our gratitude. 2 weeks ago, on March 11th, we passed what was the 1-year mark of the first COVID positive patient to be admitted to Northern Westchester Hospital, along with 2 ER patients that were then sent home. This 1-year remembrance was marked here at the hospital by a number of events. And for us, it recalls certainly an intense year of activity, but a very positive response and a gratitude for you, for our community, for showing up and supporting this hospital day in and day out for many months during the pandemic, even with donations and food and cards and letters. So we thank you for that. And while the pandemic still persists, there is light at the end of the tunnel, and we'll talk about vaccine in just a few moments. So first of all, thank you. And thank you for your patience as we have navigated the COVID pandemic over the past year, often blindly and not knowing what's next, but we appreciate your patience and your support of the hospital. So with that, I'm going to go ahead and share a slide. I will ask Dr. Koroly to give us an update on the 3 vaccines currently on the market.
Okay, thank you, Derek. So as most people are aware, there are 3 vaccines that in the United States are currently approved for emergency use authorization by the FDA for immunization against the virus that causes COVID-19. Those are the Pfizer vaccine, the Moderna vaccine, and the Janssen or J&J vaccine. They're all slightly different from one another. Both the Pfizer and Moderna have been around a little bit longer, since December, and they're 95 and 94% effective, respectfully. They both require 2 shots. Pfizer's 21 days apart between the 2, and Moderna is 28 days apart. They both work in the same fashion. They're what's called a messenger RNA vaccine. So it's a piece of RNA being injected that codes for the protein to make antibodies against the protein that's found in the coronavirus. The Pfizer requires significant cold storage, the Moderna just a regular freezer, but those requirements made it a little challenging for everybody to store and administer. More recently, the Janssen vaccine is a single dose. It's a little bit less effective, 72% in the United States, about 66 to 68% throughout the rest of the world. It is only one shot. And although it is less effective overall, it is significantly more effective than 72% at preventing severe COVID disease. And no one that received the vaccine in the study died from COVID. So it's still a very beneficial and positive resource for us. The mechanism is a little bit different than the other two. It's an actual harmless virus that's injected and carrying the RNA rather than the RNA itself being injected. And it's a little bit easier to store. It can stay up to 3 months in a regular refrigerator. So they're all slightly different. Many people have been vaccinated, about 60 million with some combination of these vaccines. And so far, there have been no deaths or serious illnesses related to the vaccine. Some people do have allergic reactions, including anaphylaxis. It's thought that the Janssen J&J vaccine is less likely to cause severe allergic reaction. The other thing that people ask is whether or not these vaccines are helpful against the variants that we hear about. So there are a lot of variants going around the world that you may have heard about for this virus. There's the United Kingdom variant, which has become common in this country, a South African variant, a Brazil variant, a New York variant, a California variant. And we don't know as much about how the vaccines work against the variants. However, we do think that there's some effectiveness. There's evidence to date to show that it probably is effective against the United Kingdom variant, probably somewhat effective against South Africa, but less so. Moderna, one of the companies, has now started a new clinical trial using a variation of the vaccine that's targeting specifically against the South African variant as a booster. So all of these companies will be adjusting some of the vaccines for boosters to start to work against the variant. So it's still positive in that we think that there's a good hope against protection against these as well. Other common question that people have asked is whether or not it's safe for women who are pregnant or nursing to get the vaccine. And although none of these vaccines in the initial studies were tested in pregnant women, we do believe it's probably safe, but it's really a personal decision that each person has to make. I can tell you that about 20,000 pregnant women so far have received the vaccine in this country, and there have been no reported serious or dangerous reactions to either the mom or the baby. So far, again, it looks promising that it would be safe for pregnant women. The other common question that people ask is, okay, so now I'm vaccinated, what do I do differently? So there's certain things that you can do differently, but you still have to be really careful. Not everyone's vaccinated and the vaccines are not 100% effective, and there are these variants. So even though you're vaccinated, we still recommend in public areas that you would wear a mask and practice social distancing, just like we've been doing all along. We do believe, however, that for those that are vaccinated, you can probably gather indoors with all of you having been vaccinated safely without masks. So that helps with relatively small family gatherings, again, assuming everybody's been vaccinated. If someone in the family or one of the friends has not been vaccinated, then we still recommend keeping the masks on for everybody, especially if some of those unvaccinated people are at high risk for complications from developing COVID. And the last question that comes up is often about travel. And I do believe it's anticipated that as of April 1st, travel restrictions will be relaxed, where we do not have to quarantine any longer for domestic travel. And that will probably apply to both vaccinated and unvaccinated people, unless you were to develop symptoms, in which case we recommend getting tested. So a lot of positive coming down the horizon related to all three of these vaccines. And again, if you have specific questions, you can ask them in the question and answer part of your screen.
Great, thank you, Dr. Koroly. So For those of you who just joined us, my name is Derek Anderson. I'm the executive director of the hospital, and Dr. Marla Koroly is our chief medical officer. We're giving an update on COVID and the vaccine. For those who are joining us from Facebook, welcome. Those who are joining via Zoom, welcome. We encourage both of you, please feel free to post questions in the Q&A or on Facebook, and we'll try to get to as many of those questions as possible in just a few minutes. So just moving forward, who is eligible? As of this morning, we received word, and this was announced publicly, that as of tomorrow morning, March 23rd, anyone 50 years and older is now eligible to receive the vaccine, including anyone on medical risk factors, which are the immunocompromised or the comorbidities. There is a defined list with New York State. So please check the New York State website for that specific eligibility. And then there are specific job classes like government forward-facing employees, the DMV, et cetera, that are also eligible. So that list has now been expanded as of today, going into effect tomorrow morning. To check your eligibility is still the same website, the COVID-19 vaccine.health.newyork.gov. Where can you get vaccinated? So right now, easiest way to understand this and the way that the state has organized this is all large sites like the County Center, the Javits Center, Jones Beach. Those are state-run, let's call them large operations, mega centers that they're doing thousands of individuals per day. Outside of the large state-run sites, and those appointments are through appointment only on that same website, the COVID-19 vaccine.health.newyork.gov. In addition to that, the state has provided allocation. It's on a week-to-week basis, so we don't always know what the allocation is to providers. Providers include hospitals, medical groups, as well as local pharmacies. The state is looking to get as much supply as possible, but we know and we've read about the supply issues currently don't meet the demand. But as Johnson & Johnson becomes more readily available, and as the manufacturers, and as we've heard at the national level, that they are looking to ramp up and increase supply. As they do that, providers like Northern Westchester Hospital are ready to set up the operations just as we have so far. In the past couple of months, we vaccinated close to 8,000 individuals. That's first and second dose for the community. That's purely based off of supply. And we appreciate our community partners like our local elected officials, Open Door, Neighbors Link, the Fox Senior Center, and a number of others who had helped us really distribute the vaccine in an equitable and fair way. All appointments are by scheduled in advance appointments only. We do not take walk-ins, nor does the hospital have an ability to call and schedule an appointment for you. As we look at the infrastructure of hospitals, we're grateful for the opportunity to provide the vaccine. We're only able as far as we're given supply. And remember, hospitals are not always built as that public health infrastructure. So this is the hospital looking to maintain the high quality standards of the hospital, in addition to try and do this for the community. So we're balancing both. And so we appreciate everybody's patience with us and acknowledge the frustration that it has been for everyone to try and get an appointment. And we try to help navigate as best as possible, but please know we're all trying to really figure this out as we go. Let me just back up one step. For any of those provider locations like Northern Westchester Hospital or Northwell Health, this is across the region, any Northwell or Northern Westchester Hospital appointments are posted to northwell.edu/COVID vaccine. Those two locations, the state site for the large state-run facilities and operations, and then the provider locations for Northwell, those are the only two web addresses that are offering, and they're posting somewhat sporadically. It just depends on when and how supply comes in. How do you get COVID testing, and this still remains important for us to early detect if somebody has COVID, and for them to follow the CDC state guidelines around quarantine if you have been exposed. Today, we continue to offer free COVID testing, no prescription required, but you must make an appointment at our ambulatory location next to Whole Foods in Chappaqua. It's at Chappaqua Crossing, and the web address there you see nwh.northwell.edu/COVID-19. Schedule an appointment. There is no prescription needed, nor is there an out-of-pocket expense for that. And you can see the address there below. Dr. Koroly, could you give us an update on the field hospital and specifically the monoclonal antibody therapy that we've been offering to the community?
Yes, thank you, Derek. So a while ago, during the first wave of the COVID pandemic, we put up, you may have noticed for those of you that have passed by, in our parking lot, what we call the field hospital, which is a large, it's under, it doesn't describe it well enough to say tent, but it's a large structure where we would have expanded and been able to care for COVID patients had we run out of the capacity within the hospital. Thankfully, that never happened, and we never had to use it that way. However, beginning on December 7th of 2020, we opened up the field hospital to serve as a place to administer monoclonal antibodies. Monoclonal antibodies are medical therapies that have been shown to be very useful in patients that develop COVID-19 early on in the course, if they have certain risk factors for progressing to severe disease. They're eligible to receive, again, under emergency use authorization, an injection of these monoclonal antibodies, and that reduces the risk significantly of the person progressing to any kind of severe disease or the need for hospitalization. So we've been offering that to physicians that are in practices in the community who see such patients that are diagnosed with COVID. They refer them for treatment, and so far we've treated close to 1,000, I think 986 patients as of today in this field hospital for monoclonal antibodies, and very likely have prevented many, many hospitalizations and deaths because of this treatment. So we're continuing to do that. There are two different types of products available that we're using now. One is a Regeneron product, which is a combination of two different antibodies, and the other one is an Eli Lilly product, which is also a combination of two different monoclonal antibodies. So that's going very well.
And Dr. Koroly, if I may also give the community a quick update on in the hospital, we still have anywhere between 15 and 20 admitted COVID positive patients at any one time. This number is down from the peak in the spring, which we got up to about 95 or 100 at any one given time in the hospital. So much, much less, but we have been consistently at this 15 to 18 in the hospital for the past 5 to 7 weeks. So we're very kind of persistently staying at that level, which tells us that there continues to be community spread. Our plea to the community is just continue to practice good social distancing, be smart, so that we can keep those numbers low. We don't believe that COVID may ever go away, but we're learning to manage it. And hopefully those numbers can get to where we were in the summertime, which was anywhere between 0 and 5 on any one given day. So we're still a little bit higher than that. Very optimistic. It's much different than it was a year ago, and different than it was December and January, where we reached as high as 40 or 50 at one time. But we're still seeing that kind of persistent population.
Yes. And although there is still COVID around, if you move to the next slide, I did want to talk about other illnesses that aren't COVID. We had concerns during the first wave of the pandemic that people were significantly delaying care. And nationwide, it was found that people were avoiding going to emergency rooms, even if they had significant illnesses like chest pain, heart disease, appendicitis. And because they were delaying going, when they got there, things were much more progressed than they needed to be and harder to treat. Similarly, people delayed screening for all sorts of cardiovascular conditions and cancer. So what Derek and I want to share today is just our push to tell you that it's really important to continue to get your routine care, not to put off cancer screenings. They're there for a reason. And if you delay, then cancer can be found at a later stage and harder to treat. Here's the slide showing mammography in particular. Important to schedule your mammogram. There's a website where you can do it and schedule it at Northern Westchester. So don't delay anything. You know, if you need doctor visits, cancer screening, mammogram, colonoscopy, whatever it is, we are sure that you will be safe coming to a doctor's office or a hospital. At this hospital, we're very careful. Everybody's screened. Everything is cleaned in the environment, and it is a safe environment to receive your care.
Okay, thank you, Dr. Koroly. So we want to leave a few minutes for questions. I'm going to leave this up for just a minute, then I'll take this down. But that is the update. We'd love to answer questions for those who have joined us via Facebook, as well as Zoom. Please feel free to post questions. We have a few now that we'll attempt to answer, and then we've got about 10 minutes. So please feel free to post, but it's great to be with you as a community. Again, my name is Derek Anderson and Dr. Koroly. We're here at the hospital, and we just want to make sure you have the latest on COVID in the hospital, out of the hospital, and with the vaccine. So
someone is asking a question, Derek, of whether there's a way to get a copy of this presentation. I don't know what is stored on Facebook or on our site.
Yeah, Dr. Koroly, I think, so good question. I see that question from Sadie and Avery. We will find a way to take these slides and get them publicly posted. Sadie, if not, please contact us directly and we will get you a copy of the slides. But great question.
Okay, and I have another question in the chat that says, if we have been vaccinated but feel we are sick, should we get a COVID test and would we qualify for the monoclonal antibody? So that's a great question. And yes, even though, remember, the vaccines are not 100% effective. So even if you've been vaccinated, if you develop symptoms that you think might be COVID, you absolutely should get a test. And yes, even if you've been vaccinated, if you have COVID and the test is found to be positive, you would be eligible to receive the monoclonal antibody. That's not a contraindication to receiving the appropriate treatment. So that's a great question, though. Great. And remember that when you're vaccinated, we consider the peak immunity to happen for the Moderna and the Pfizer vaccines 2 weeks after your second dose. With the Janssen J&J vaccine, the immunity reaches its peak at 28 days after that one dose. So that just, you know, to use your judgment, certainly before those time periods, especially if you get symptoms, you could get COVID and you should get tested at any point.
And Dr. Koroly, just on this topic, BK had a question, will I test positive for antibodies after being vaccinated?
So that's a great question too, and it's a hard one to answer because it depends on what testing platform the place you go for the antibody test is using. So for the vaccines, they cause your body to make antibodies against what's called the spike protein. So a test for an antibody specifically against the spike protein will be positive. However, many of the current tests for antibodies are for more than just the spike protein. There's, you know, other proteins on the coronavirus. So that would distinguish between having had the disease and having had the vaccine. But it really depends on which testing platform the laboratory that you go to is using at any given time.
Okay, thank you, Marla. Question from somebody on Facebook. What about people with diabetes and liver disease? And how should I proceed with the vaccine?
I guess I'll answer that. So there's no contraindication to receiving the vaccine. In fact, we encourage people that have diabetes and liver disease to have the vaccine because those are risk factors for developing severe disease should they be infected with the coronavirus. So those are medical eligibility qualifications.
Great, thank you, Dr. Koroly. Lisa on Facebook also asked the question about how long do we believe it will be before everyone is eligible to receive the vaccine? And I'm happy to answer that question. What we know at the federal government level is there is a target to be able to offer enough supply for any adult in the United States to be vaccinated by May if they so desire. A lot of it's going to depend on supply. We've already started to see that supply increase. And of course, the more and more individuals that get vaccinated, the smaller the pool of eligible folks. So Lisa, I think the projection really is in the next 2 months for it to open. And certainly we've seen this with other states as recent as this weekend. A number of states, 12, I believe, opened for all adults within their state to be eligible for the vaccine. We mentioned earlier that as of today, effective tomorrow, anyone in New York 50 years and older is eligible. It's only a matter of probably weeks, is our assumption, within weeks or a month or so before it's more open even beyond the 50 and above and comorbidities and others. So just stay very close to it. We will do our best to also keep you updated. There is a question, Dr. Koroly, on vaccinating pregnant women. Will a vaccinated pregnant woman pass along the antibodies to the baby when born, therefore protecting the newborn?
So another good question. So yes, I think there are a couple of cases of vaccinated pregnant women. Remember, they weren't in the initial clinical trials, so we're just learning as we go along with anecdotal reports. But there are a couple of cases of pregnant women where antibodies were found in the baby when the newborn baby was tested. However, these are passive antibodies, so the baby's not making them themselves. So they're not going to necessarily last a long time to protect the baby. So once these studies are done for children, they probably would have to be revaccinated even if they were born to a mom while she was vaccinated, if that makes sense. And then there's also another question on how long, while we're talking about antibodies, how long they last. Unfortunately, we still don't know that. We think they last at least up to 90 days, but we think they're going to last a lot longer than that, but not years. So we're thinking that this virus will probably need to have to require boosters to protect against the virus the way we do for influenza. It changes a little bit every year. We get a flu shot every year. So that's likely to be necessary for the coronavirus. And then finally, the other question from the Greenwich Heart Society is whether vaccinated people can spread the virus. So yes, the answer is yes. When you are vaccinated, if you do contract the virus either early in the course of your vaccine regimen or at any point, you can carry it. And if you have no symptoms, you wouldn't know that you're carrying the virus, say, in your nose. So you could theoretically transmit it to someone else. However, it's much, much less likely because the amount of virus, even if you get infected after a vaccine, the amount of virus you're carrying is much, much lower than an unvaccinated person. So although you can spread it, you're much less likely to spread it, which is why we think it's relatively safe for vaccinated people to stay indoors with all other vaccinated people in a small group safely and not need to wear masks.
And Marla, just to be super clear, Peg asks the question, if we've been vaccinated, but we feel that we're sick, should we get a COVID test? And would we then qualify for the antibody treatment?
Yes. So the answer to both of those, yes, you should get tested. And you would, if you were positive and had early onset COVID-19, you would qualify for monoclonal antibody treatment, even if you had the vaccine.
Okay, great. There's another question on Facebook. Since the vaccine is not 100% effective, why is it so important to get it? And Marla, do you want to take this one and then I'll add some additional comments?
Yeah, I mean, even though it's not 100% effective, the amount, the the quality of the vaccine is incredible. 90 for the Pfizer, 95% effective; for the Moderna, 94% effective, and even for the Janssen J&J to be in the 70s or 80% effectiveness. That's huge compared to other vaccines that we've had. So if enough people get vaccinated, that will protect the whole country, essentially. And even if you do get it, when it's not 100% effective, even if you can get it, the chances are it will not be severe disease. It will be mild. You will not need to go to the hospital, and you're very unlikely to die from COVID if you've had the vaccine.
Yeah, and a lot of the ways we look at this, and this is such a great question, and honestly, we get this question a lot, why take the vaccine? It's what we're doing is we're weighing the risk of getting COVID with the risk of the vaccine. And at this point where, right, upwards of over 100 million people in the United States have received at least dose one, that is a lot of people. That tells us that the efficacy or the safety of it is strong. You weigh that risk, which is at this point very low with how many people have been vaccinated, with the risk of COVID, which is very high, especially very high risk for those who have comorbidities and underlying health concerns. And so it's the risk benefit of those two things. And we would strongly recommend people getting the vaccine. So thank you for that question. Two quick logistical questions, and then we'll wrap up. One comment first, our presentation will be posted on our Facebook page. At the bottom of the screen, you see the nwhconnect.org/sign up. Please sign up. That is our newsletter. We will keep you updated there as well. So this presentation will be posted. Somebody did ask the question, when are we allowing volunteers to come back into the hospital, and so that we can support the staff at NWH. So coincidentally, Kiva Young-Wright, who is the president of our foundation and one of our executive leaders here at the hospital, and I were having this exact conversation this morning. At this time, because we are trying to minimize the number of individuals in the hospital, we are looking and already have, as of a week ago, expanded visitation to allow loved ones of our patients to come in. And we'd like to get visitation to a point where our patients and their family members feel comfortable with that, with still very clear checkpoints when you arrive: temperature, screening questions. Volunteers, we are not ready yet at Northern Westchester Hospital or across Northwell Health on volunteers. They are the lifeblood in many ways of our hospital, and we miss them dearly. We miss interacting with them. We miss them sitting with our patients. Right now, we don't want their safety to be compromised, nor are we looking yet to have additional people circulating within the building. And so we're looking for the community to continue to seek vaccination. And when we get to that point, when we feel that we do have that kind of level of herd immunity, or we can protect our volunteers, we would love, and we're very anxious to get our volunteers back. And thank you to what equates to almost 300 volunteers at Northern Westchester Hospital that we haven't seen in over a year now. Lastly, question on booking appointments. When you have your first vaccine appointment here at Northern Westchester Hospital, as well as Northwell Health, any of our facilities, when you get the first appointment, you're automatically scheduling your second appointment at the time of your first dose. You do not need to go back to the website. You don't need to keep refreshing and clicking. We schedule that for you upon leaving after your first dose. So I think with that, Marla, I'm going to give you one more question and then we're going to wrap up. And I'm sorry, we have a number of other questions that we're just not going to get to. Thank you for everybody for joining us. But one last question, and then you see ways to stay connected with the hospital as things continue to change. Is it true, Dr. Koroly, that older people have lower side effects after the second shot than younger people?
That is true, Derek. People that are older, I can't even define the number, but the older you get, the less likely that you're going to have a reaction to either of the two doses for some reason. So it doesn't mean it's not working, but you're less likely to get fever, achiness, and different kinds of side effects that people that are younger tend to feel. Not 100%. Some people that are older do get some side effects, but definitely less likely.
Okay, great. Okay, and I promise one last question, then we're going to wrap up. If a vaccinated mother is breastfeeding, their newborn, does it continue to give the baby the passive antibodies?
We think so, but still too early to tell. This is so brand new that we have pregnant women that have been vaccinated, that have had a baby and that are nursing, and that we've tested the baby. So it's hard to say 100% whether the passive antibodies are transmitted to the baby. We think they are, but we're not fully sure yet.
Okay, great. All right, well, thank you. We, again, appreciate everything our community is doing to support our patients, the community, the hospital. Thank you for joining us. Stay connected, stay well, and we appreciate your time this afternoon. Take care.
Thank you.